Hello, class. My name is Anna Parada, and today I'm going to be presenting on obsessive compulsive disorder. So, what is OCD? OCD is a common chronic and long lasting disorder in which a person has uncontrollable recurring thoughts and behaviors that he or she feels the urge to repeat over and over again. So, some symptoms of OCD are obsessions and compulsions. So, obsessions are repeated thoughts, and compulsions are repeated behaviors. So, some thoughts that people with OCD have is fear of contamination or thoughts about symmetry, and compulsions are repeated behaviors on things like washing your hands, opening and closing doors, and ordering and arranging. So today, a lot of people mention OCD very lightly, and sometimes people joke around with it. Your friends will tell you, "Oh, you have OCD" when you're doing like an activity like cleaning, but it's a very serious condition that a lot of people have. So this leads to my next point, which is what's the difference between someone who has OCD and someone who doesn't? So people with OCD will spend over an hour completing a compulsive behavior. Um, that compulsive behavior will more often like it will impact their daily life because they are spending so much time on the behavior. And lastly, people with OCD, they can't control their behaviors or their thoughts as much as they try. So who does it affect? OCD affects women, men, and children equally. It doesn't matter what race or ethnicity or socioeconomical background you come from. There are theories on who gets OCD, and those theories are the biology theory, which is a theory that says that OCD is a result of your body brain chemistry. The genetic theory says that specific genes cause OCD, but those genes have not been identified yet. And lastly, there's a theory of learning, which says that you learn OCD from family members who have it. So now I want to get into the biology of OCD. So according to Stanford Medicine, they have done brain imaging studies on people with OCD, and they have found that there is hyperactivity in the subcortical and cortical regions. So the subcortical regions include the diencephalon, the pituitary gland, which controls hormone secretion, and the basal ganglia. So, one important structure in somebody who has OCD is the caudate nucleus. The caudate nucleus is within the subcortical structure and is near the thalamus. It is usually C-shaped, and as you can see here in the image, it is the structure in red. Its functions are learning, memory, movement, reward, emotion, and motivation. So people with OCD who have dysfunctions in the caudate nucleus will have increased activity in that area, and it will stop functions of the globus pallidus, which then decreases activity in the thalamus. So people who have dysfunctions in the caudate nucleus also include people who have mental disorders like Parkinson's disease, ADHD, bipolar disorder, and schizophrenia. One important thing to mention about the caudate nucleus is that it is involved in association learning, which means that it connects visual images to motor responses and learning. The next structure that is important to mention in the brain of someone who has OCD is the thalamus. So the thalamus is a structure in the diencephalon, and people who have OCD have increased activity in the thalamus that leads to increased activity in the orbital frontal cortex, which then leads to the increased activity in the caudate nucleus, which I just spoke about. So, MRI imaging done of people who have OCD have found that they actually have a smaller caudate nucleus than people who don't have OCD. It is also believed that cleaning behaviors and checking behaviors are originated in the thalamus, and which is why people who have OCD have dysfunctions in this area. Another important function that happens in the brain of a person with OCD is the neural loop. So, the neural loop is a loop that runs from the orbital frontal cortex through the caudate nucleus, through the globus pallidus, through the thalamus, and back to the frontal cortex. So, people who have OCD will have interruptions in this loop, which can cause obsessive and compulsive symptoms. This impairment will often lead to excessive output of thalamus activity, which also can cause OCD symptoms. And lastly, increased caudate nucleus functions in the loop will cause hyperactivity within the loop, which in turn will also lead to symptoms of OCD. So now I want to talk more on the genetics of OCD. There have been studies done in family and twins, and those studies have shown that parents and siblings with OCD are more likely to pass it on to you. And it is also found that it is you are more likely to get OCD if that family member that is close to you developed OCD as a child. So now I'm going to talk about the psychology of OCD. So OCD is treated with medication and psychotherapy. Psychotherapy includes cognitive behavior therapy and exposure and response therapy. Exposure and response therapy is when a patient is exposed to something that triggers them and they are not able to act on the compulsion, and it's very effective in reducing behaviors of OCD. Also, something important to mention is that OCD patients usually have other mental disorders, for example, anxiety and depression and body dysmorphic disorder, which is why cognitive behavior therapy is very effective in people who have OCD. So, for my presentation, I want to focus more on the psychological causes of stressful life events that can cause somebody to develop OCD. So, mental disorders and stressful life events can increase your chance of developing OCD. So, this happens because stressful life events can trigger intrusive thoughts, emotional distress, and ritual forming behaviors. So, these life events include things like starting a new job, giving birth, or getting into a car crash. For children, usually for childhood experiences, trauma happens and the child develops OCD as a result of the trauma or the abuse or the bullying that they experienced when they were young. And it's actually a way that the child copes with the anxiety of the life event that they just went through. So, trauma is important to someone with OCD because OCD is an extremely individualized disorder. This means that usually someone with OCD will have a theme to their disorder. So, those themes include contamination, guilt and responsibility of harm, taboo thoughts on sex and violence, and need for symmetry. So, usually the theme of their disorder of the OCD is related to the traumatic event that they have experienced already. So, this means that, OCD is developed as a result of a patient's past experience with trauma. So, most people experience intrusive thoughts, but we quickly let them go. Someone who has OCD will have a hard time letting go of those intrusive thoughts, and that is because they have a dysfunctional adaptation as a result of them not being able to process a certain event. So, people with OCD will turn a stressful life event into a personally significant event, or they will take responsibility for it. So this means that when they are in stressful situations, it can trigger obsessional thoughts in them. It can also happen that if the stressful situation is very stressful, it will cause a greater frequency of intrusive thoughts. So, usually in people with OCD, these behaviors of like obsession and compulsions are happening because they are trying to avoid a stressful event from happening again. So, trauma distress happens after a traumatic event in a person, and usually you have to interpret it and give it meaning. But someone with OCD will interpret that event and it will relate to how dangerous or threatening it was to them, which will then cause neutralizing behaviors. And this is also similar in people who have PTSD, um, except that people who have PTSD interpret the event as current, real, and significant. So the similarities between people with OCD and people with PTSD is that, like I mentioned, they both create these neutralizing behaviors where they suppress thoughts, they isolate themselves, or they create safety behaviors, like, for example, washing your hands or hyper arousal or emotional numbing. So OCD and PTSD are very similar and can be related in the sense that when somebody experiences a traumatic experience like physical and sexual assault, they will create a role of disgust, which happens when the traumatic victimization they receive causes feelings of disgust. So those feelings of disgust will then lead to OCD behaviors of cleanliness, which is within the contamination theme, and which then leads to them constantly washing their hands or taking a shower or checking if the door is locked. So sometimes the behavior of OCD is determined by how great the betrayal of the trauma was, which then will lead to the development of the disorder. So, traumatic childhood experiences are important to note because most people will develop OCD in their childhood, and this will happen to children who are anxious, depressed before a traumatic event happens, and is why they are more likely to develop OCD. So, childhood experiences are important because when you experience a traumatic experience early on in life, the child shapes their view of the world around the event and their personal responsibility to it. And it creates a schema about their future. And then they perpetuate rituals to reduce anxiety around that event. So there is treatment for OCD, and that includes serotonin reuptake inhibitors, which reduces OCD symptoms. There is psychotherapy, which we spoke about, which includes cognitive behavior therapy, and there is also participation in clinical trials. So, here are the sources that I used for my research. I really hope that you learned something from this presentation, and thank you for watching. Goodbye.